External features of the kidney. Kidney is a part of excretory system. It removes the waste of metabolism, excess salt, and excess water, and helps in maintain pH. Helps in maintaining pH. This is a general introduction about kidney. If we look at the location, this is the organ of posterior abdominal wall. So today's topic is external feature of the kidney. Here there are few synonyms जो kidney से related होते हैं like renis, renal and nephron. अगर हम define करें kidney को, so these are the pair of excretory organs situated on the posterior abdominal wall, one on each side of the vertebral column behind the peritoneum. It means it is a retroperitoneal organ, or we can say it is anteriorly covered by the peritoneum only. So abdominal area is divided into 9 quadrants 1, 2, 3, 4, 5, 6 and 7, 8, 9 by the two horizontal plane. One is transpyloric plane, one is transtubercle plane, and two vertical lines, that is right lateral line and the left lateral line. So what are these? Transpyloric plane is a imaginary plane. Transpyloric plane is a imaginary plane, and it roughly midway between the jugular notch and pubic symphysis. Transtubercle plane, also known as subcostal plane, and it passes through the iliac tubercles, which is the most lateral point on the iliac crest. And if we look at the level of vertebra, this is at the level of L5 vertebra. In center, the vertebra column is lying, and transpyloric plane is at the level of L1 vertebra. And these two lateral lines are passes midclavicular line, also known as midclavicular line, passes midway between the clavicle. So this is how abdomen is divided into 9 quadrants, and each organ is lying in these quadrants. So what is the importance of these quadrants? One is the surgical intervention. We can easily understand the location of each organ. Secondly, for radiographic imaging, and also to understand the easily understand the anatomy of each organ and location as well. So kidney out of these quadrant lies in hypochondriac, right hypochondriac, right kidney, epigastric, lumbar, umbilical, and left into the left hypochondriac, left lumbar, epigastric, and umbilical. So location, kidney occupies the epigastric. ये हमने पहले देख लिया है कि it is a posterior abdominal wall organ and only anteriorly covered by the peritoneum, or we can say retroperitoneum. Kidney occupies the epigastric, hypochondriac, lumbar, and umbilical region. Now we can easily understand what are these. Vertically, if we look at the vertebral level, it extends from T12 to L3 vertebra. If we look at the closely at the both kidney right and left, the right kidney is slightly lower than the left kidney in the position, and left kidney is little near to the median plane. So here you can see right kidney, if we pass a plane here, is a little bit lower than the left kidney, and left kidney, if we pass a midline structure, is close to the midline structure, and the approximate distance between the two kidney is the 5 centimeter. This is the transpyloric plane and the intertubercle plane. And this structure is the ureter, which is attached with this hilus of the kidney. Now, when we look at a kidney, firstly it is a bean shaped and it has a upper pole. This is the upper pole and a lower pole. It has two borders, the lateral border and the medial border, where the hilum is attached. Hilus is attached, medial border. And it has two surfaces. The one is the anterior and back side, resting on the back muscles is the posterior surface. So externally we can see all these borders, surfaces and the two poles, upper and lower poles. So each kidney is a bean shape. It has upper and lower pole, medial and lateral border, and anterior and posterior surface. The upper pole is broad and in close contact with the suprarenal gland, and lower pole is pointed. If you look at the surfaces, the anterior surface is irregular and posterior surface is flat. Lateral border is convex and medial border is concave. But if you look at a kidney, it is difficult to recognize the anterior and posterior aspect of kidney. So how we can determine the important structure is hilum of kidney. We examine the hilum of kidney and we can decide which part is going to be upper side of kidney in a cadaveric specimen and which part is going to be the lower. And we can also decide anterior surface and the posterior surface of kidney by looking at the hilum. How? Hilum, firstly, it is located at the medial side, medial surface. Secondly, there is an arrangement of structure from anterior to posterior side. The code, or we can say mnemonic, is for this to remember this is VAP. Renal vein, that is a part of inferior vena cava. Renal artery, branch of abdominal aorta. And renal pelvis, which is the upper expanded part of the ureter. As I told you earlier, ureter is connected with the kidney, hilum of kidney. So arrangement of structure is renal vein, renal artery and renal pelvis. So after examination this structure, we can define the anterior and posterior aspect and also the superior and inferior pole of the kidney. So we also can say कि kidney belong to the which side, either right side or left side.